Thank you very much and good morning everybody. It's an absolute pleasure to be here, and on my behalf and on behalf of Laura, we'd really like to welcome you and to thank you for coming to today's event. I would urge all of you to go and feel what it's like to turn on a TV with your legs. There's a bike in the room behind us, and by putting a lot of effort into its rotation, it's supposed to demonstrate how much energy goes into producing electricity, and it's a good thing to do. So if my heart is still palpitating, that's actually why. So I'm here to talk to you this morning about the HSE's strategy to improve health and well-being of our population, of our service users, of our patients, of our staff, and indeed the communities in which we work. And the approach that we are taking is very much informed by government policy in relation to the Healthy Ireland framework. And initially, I want to kind of touch off, I suppose, on the broader global context within which this framework, I think, is best situated. So if we look at the Rio Declaration in Principle 1, it states that human beings are at the centre of concerns for sustainable development. They are entitled to a healthy and productive life in harmony with nature. And we know that the goals of sustainable development can't be achieved if we have significant levels of debilitating illness. And we certainly can't maintain population health improvement without ecologically sustainable development. And there is an increasing focus globally and indeed within other jurisdictions in relation to the impact that the environment has upon health. Estimates coming from the World Health Organization that 23% of all global deaths are linked to the environment, and 2/3 of those due to non-communicable diseases such as stroke, heart disease, and unintentional injuries and cancers. And if we look at the Sustainable Development Goals, and we specifically look at Goal 3, which is to ensure that health and well-being is there for all at every stage of life. So that's looking from reproductive health, maternal health, child health, communicable, non-communicable diseases, looking at safe, effective access to medicines and to vaccines for people. It talks about better investment in terms of health systems, in terms of universal health care. It talks about strengthening capacity, of course, very importantly from an environmental protection point of view, to risk and risk reduction and management, and indeed increased health financing. And we know, of course, that unhealthy environment and unhealthy environmental conditions increase the risk of both non-communicable and infectious diseases. And that is very much reflected strongly, I think, in the integrated nature of those Sustainable Development Goals. We know, and there are estimates with regard to the number of people who die globally from infectious diseases, whether that's from fecal contamination in water, whether it's from inadequate hand washing facilities and hand hygiene, or indeed whether it's from household or ambient air kind of pollution across different jurisdictions. And indeed, if you look at recent EPA publications, you will see that we still have some way to go with regard to addressing traditional environmental threats to health. At the same time, we also need to address emerging environmental threats, and Sustainable Development Goal 13 calls for urgent action to combat climate change and its impacts. It actually states that climate change presents the single biggest threat to development, and its widespread, unprecedented impacts will disproportionately burden the poorest and the most vulnerable. Urgent action to combat climate change and minimise its disruptions is integral to the successful implementation of the Sustainable Development Goals. So, health has become more of a central concern in development, both as a contributor to and indeed as an indicator of sustainable development. And while health is a value in its own right, it's also key to productivity. And from our perspective in relation to looking at health and well-being, there's actually a really interesting kind of emergent literature in the whole area of well-being, where we can see that improved levels of individual well-being, and in particular community well-being, is related to lower levels of crime within those communities, lower levels of violence, higher levels of employment, higher levels of education, higher levels of economic output, and kind of social cohesion. And indeed, some jurisdictions are looking at, certainly supported by kind of academic evidence, at the value of looking at population measures of well-being as better indicators of social and economic output when you compare it to measures like GNP. But of course, the piece that's underpinning Healthy Ireland that links it to the broader kind of global sustainable development goals is that many of the key determinants of health and disease, as well as its solutions, lie outside of the actual direct control of the health sector itself. So it lies in the environment, it lies in relation to water and sanitation, agriculture, trade, housing, education, employment, energy, cross-border travel, which of course means that we really need to take a much more kind of systemic approach to how we concentrate our efforts around improving health, addressing health inequalities and addressing risks to health within the population. And indeed, there's a huge amount of initiatives and endeavours happening that take on board those issues, trying to drive improved kind of community health. And you'll be familiar with a lot of those. In Ireland here, we have a significant amount of work being led by our local authorities with regard to having age-friendly cities and counties. Yesterday, there was a launch of the next phase of our Healthy Cities and Counties, and you'll see another stand out in the room behind you this morning explaining about that. And within the health service, we're playing a key role and an important role in working to support our partners and in acknowledging the leadership that they're providing in relation to improving the health and improving the living conditions of the citizens within those geographic boundaries and within the country as a whole. And as I say, addressing the underlying determinants of health is key, of course, to ensuring longer-term sustainable development. The Healthy Ireland framework really is a kind of a rallying call. It provides a mandate, there's a level of authority behind it. Its progress in relation to its implementation is reported into a Cabinet Committee on Social Policy. The Department of Health is responsible for coordinating and driving the implementation of it across other government departments. Its goals are about improving the health of the population, reducing health inequalities, protecting the public from threats to health and well-being, and creating an environment whereby every sector of society can play its part. And I suppose for us within the health service, why is this really important, or why do I think it's important to think of the bigger picture in relation to population health improvement and health inequalities? Within the health service in Ireland, we know that we're going to see an increase in demand of between 20 and 30% over the next 10 years. We know that rising demand in the health service that we can see now and that we can project into the future is attributed to increasing levels of the numbers of people within the population, and the population is ageing. It's ageing faster in Ireland than it is anywhere else in Europe. And that, unfortunately, whilst we're living longer, we're not living longer in good health. We have a significant issue with regard to increases in chronic diseases, which are attributed to those 5 or 6 things there on the bullet points on the list. And we know that in order to address those risk factors, we need to go back to what we've been talking about with regard to the broader social determinants. And within the healthcare system, what we know is that by having a larger population that is ageing, that we need to actually ensure the prevention, that early detection, that self-care and self-management for chronic diseases underpins our work, and that we need to be as concerned about health as we are about hospitals. As Duncan Selby mentioned in the UK some time ago. And indeed, the fact that we're living longer brings with it such fantastic opportunities, but we need to make sure that the trends correct themselves so that actually those opportunities can be realised. From a health service perspective, it means that we need to look at care for people as they age outside of hospitals, within communities and within people's homes, and looking at the opportunities that are there through technology and so on and so forth. And you can see that we have much better data. There's a lot to be done with regard to improving health system data, but we have much better data coming from longitudinal studies in Ireland. We have a longitudinal study in ageing, a longitudinal study on children. And we know, for example, from the TILDA study that 80% of adults in Ireland over the age of 50 are overweight or obese. And indeed, the clinical, the social, the psychological, and the financial implications of rising levels of obesity are still to be determined, but we certainly know that there's a lot that we need to be doing about it. So we talked about the broader risk factors. So I'm putting this here, the spaghetti kind of diagram. It comes originally from the Foresight report in the UK looking at the determinants of obesity. And we know that we cannot address rising levels of obesity by purely looking at the individual. There are systemic risks, there are systemic issues ranging from food production to food distribution, to farming, to parks, to playgrounds, to education, to housing, similar to the list that I mentioned previously. And in order to address that, the kind of global direction and the European direction through Health 2020 framework is about health in all policies. Some jurisdictions are legislating for that, and it's interesting to see the impacts that that's having in terms of policies across government. But again, from a health perspective, what we're trying to ensure is that framework has sticking power, that it can transition across the political cycle, and that we can build much greater energy through partnerships like the partnerships that we have with the EPA, and that is evidenced today in the work that we're doing together, to ensure that we can deliver on the broader agenda. That means that within the health service, we actually have to walk the walk and talk the talk. So we are actively trying to do what I mentioned earlier, which is embed prevention, early detection, self-care, self-management into our clinical models of care. And in fact, looking at our own health and wellbeing, our own environments from a green point of view, but also from a staff health and wellbeing point of view. It's fair to say with regard to the Healthy Ireland framework that there are some elements of it that are very specific to the health service also, particularly with regard to health protection. So protecting the public from threats to health and wellbeing, and ensuring that we have effective strategies and interventions to protect the public from threats to health and wellbeing is an important part of that agenda. That's an example of some of the things that we're trying to do, and as much as we're looking at convergence at the national level, and I would say there's a lot there to discuss maybe for another day with regard to convergence kind of globally across these kind of like issues. Certainly within Ireland we have burgeoning strategies coming from different kind of government departments, whether it's on ageing or dementia, whether it's on transport, whether it's on technology, whether it's on better outcomes, brighter futures for our children. And what we're trying to do within the health service for the piece that we're responsible for is to put in place strong implementation capability for translating those strategies into tangible actions across the health service, having leads in place and ensuring that we have good research and good communications capacity to bring those strategies to life. And the Healthy Ireland framework is very much alive and kicking within the health service right now, which is really good in terms of building partners, building a network of leaders and advocates for this agenda, which is very challenging. Obviously, I'm very proud to work in the health service, and I work with absolutely amazing colleagues who deliver great care from a patient perspective, but a great environment as well to try and do things differently. We know, as Margaret Chan once said, that the threats to kind of global health and the profile in terms of what health looks like across different jurisdictions and indeed within them from a health inequalities perspective means that a business as usual approach is no longer tenable. And Healthy Ireland is really about saying that actually we're not doing the business as usual approach. We want to do something different. We acknowledge that that's challenging, but we certainly feel that within the health sector we've got a whole lot of champions and people who are pioneering this agenda, and we know that it won't deliver unless we make it stick and unless we ensure that the approaches that we're taking are built into our systems. So how do we take this big, huge document within the health service? Well, what we did was we identified 3 priority actions, one around health service reform. Everything that we do to reform the health service has to take cognizance of that particular approach. Reducing the burden of chronic disease. We have over 100,000 staff in the health service. We have millions and millions of contacts every day. We have connections into people's homes, into people's communities. We can make every contact count. And improving staff health and wellbeing. And we have an implementation infrastructure to deliver that through our 9 community healthcare organisations, and we have new leads of health and wellbeing, some of whom are here today, and you're very welcome, through our hospital groups, through our national services and divisions, and Jane Carlin is here today, who's the head of health business services, is responsible for all the estates and facilities, procurement. All of those functions play a critically important part in terms of making the Healthy Ireland framework come to life in the health service, and of course our partners reaching out both from a citizen point of view and indeed from a private sector and public sector point of view. The foundations underpinning it are around structural reform. Any change to structural reform, like the creation of those new community healthcare organisations, we have a head of health and wellbeing at the senior management team. Financial reforms, how do we incentivise this behaviour over time? How do we ensure that hospitals that have lower rates of healthcare associated infections are rewarded differently to others? Through service reform, through our partnerships, through integrated care programmes and models of care. If we want to embed prevention, early detection and self-care, then we need to prescribe them in an evidence-based way, working with our clinical leaders to design those pathways, and obviously knowledge and information being critical to it. So that's currently how we are conceiving this kind of big picture Healthy Ireland framework in terms of the health service and our role to create much stronger kind of advocates for this agenda over time. So as much as we're trying to create networks in health and networks with our partner, I think that probably the next phase of this for kind of exploration, really, we're only really just kind of like thinking about is that how do we actually network the networks? And I think that maybe today that's what elements of that is actually about. We have a long history of collaboration with our goal of protecting the public from threats to health and wellbeing with the Environmental Protection Agency. And tangible elements of this collaboration include the HSE's participation on the EPA's Health Advisory Committee and the publication of a range of joint papers. However, last year, both organisations recommitted themselves to this goal by signing a Memorandum of Understanding, which has led to even closer ties, including the co-funding of research, again, examples of which can be seen in the room behind us today. And I think that both myself and Laura and our teams feel very strongly that we probably do need to move away from that business as usual approach, making sure that we're both fulfilling our statutory responsibilities and collaborating, but maybe collaborating at a higher level to deliver a kind of greater good, and maybe mobilising more support across our partners on the public sector and the private sector, taking that community approach. There's no doubt that the challenges to creating a truly healthy population are significant. Trying to do it within a health sector where you don't get any credit, I would think probably you'd all agree, positively reinforcing your work on a daily or a weekly or even an annual basis if you look at the papers in relation to the health service in Ireland. But there is great work happening, and there's great work happening through the leadership within local authorities in Ireland, some fantastic people working and wanting to support this agenda, but we do need to work much more smartly if we're to deliver it. There's a lot of, as I say, I think there's a lot to be gained from looking across those policies from a convergence point of view. Lots of local authorities in Ireland, particularly some of the smaller ones, don't have the capacity to be able to take on board an age-friendly agenda, plus a healthy city and counties agenda, plus a suicide prevention agenda. And when we look at it, the actual high-level outcomes and objectives that we should all be working to from a measurement point of view are actually the same. And I'd like to finish with a quote from Martin Luther King, which is, "All of life is interrelated. We are caught in an inescapable network of mutuality, tied to a single garment of destiny. Whatever affects one directly affects us all indirectly." And I think that if we think about that from the perspective of, the bodies that we're born with, the air that we breathe, the families that we have, the communities that we're in, the environment that we live in, I think that it's quite a profound statement and a nice one to finish on. So thank you all for listening.